So neck liposuction means removing the fat underneath the chin. It's one of the more common things that people request in my office because, now everything in the media is, having a really defined jawline. And there have been other minimally invasive options out there in the last few years, like Kybella or Cool Sculpting, and really they don't give a very dramatic result in a timely manner. So both Cool Sculpting and Kybella, you have to do multiple treatments and it's very costly. So often I can do neck liposuction in a much more economical way and in the office under local anesthesia. Sometimes I'll pair neck liposuction with face tight if the skin needs to be tightened as well. But in a younger person, 20s, early 30s, neck liposuction alone is usually all that's needed. So when I do neck liposuction, I mark out tiny incisions in the middle and on the sides at the angle of your jawline. I use tumescent anesthesia, which is a really diluted local anesthesia, so it'll be completely numb. And then I make tiny little poke holes for the liposuction cannula to go in. And I just contour and sculpt the jawline to the appropriate shape. And I use a special technique to try to anchor the skin down onto the remaining fat in the neck. And afterwards, I close the incision either with a few tapes or with tiny dissolving stitches and place a wrap around your jawline just for some support because you will get some swelling. And that's about it. It takes about 45 minutes in the office. The main risk to neck liposuction is damage to the marginal mandibular nerve, so the nerve that moves the lower lip. As long as you're staying in the right plane of the neck, the risk of that is minimal. And sometimes I've seen some short-term movement changes, but in the long term I've never seen a permanent nerve damage in that area. The main recovery to this procedure is some swelling and bruising, but not a lot. In general, Cool Sculpting and Kybella have much more of a recovery time and swelling than neck liposuction. So it's mostly sitting at home, wearing your wrap, or going out and about if you aren't self-conscious about that. And in a week's time, you're good and the incision heals and you can't really even see it.